it is definitely worse than the so-called first wave that we saw in January. And at that moment, to be very honest with you, I thought it was very bad in January, and we had a downtrending, right? So I thought that, oh, it's a good thing. And also in January we have the vaccine in Indonesia. So I was really hoping that we only had that wave, that only first wave, and we are not we are not going to go to this second wave. But today is it's just so much worse than the first wave.
Now, you work on the front lines in Jakarta. What is the situation in hospitals there? Are there enough beds? Is there enough oxygen?
Definitely not. It's funny, if you or anybody who's watching this have friends in Indonesia, and you can check our social media, it's just so full of people looking out for oxygen, people looking out for plasma convalescence, people looking out for other COVID treatment, because we do not have that in the hospital. So the hospital is asking the patients to actually help us looking for the oxygen or the therapy that we might need. And speaking of the healthcare workers too, we are pretty tired. This is a bit too much for us.
Yeah, you, as you've said, you've worked through both waves now. How are you coping? Are you afraid of being infected?
The fear is always there, and I believe that we kind of need that fear, so that it can remind us to be more careful and to wear the PPEs properly, to just take care of ourselves so that we are not infected with the virus. But I really hope that my colleagues and I are surviving through the second wave.
Do you get a sense that the situation is going to have to get worse before it can get better?
I hope not, but if we look at the graph, we are probably going to get a little bit worse before we can actually get better, because the number is just increasing since 1 or 2 weeks ago. So even if the vaccination rollout, we are accelerating our vaccination, right? So even if that works, it might take some time for it to actually make some effect. And most probably we are going to see the downtrending by next month, hopefully.
But what has gone wrong? Only a few months ago, it seemed like Indonesia was on top of coronavirus, and it has just descended.
Yeah. I think there's a few factors in it. So we know that the Delta variant has been here in Indonesia since January. We did genomic sequencing and we know that it's been here, but people did not know that it's been here, and people were not aware of this Delta variant. At the same time, we also had the vaccines arrived in Indonesia, but the rollout, I guess, has not been as quickly as I'd like it to be. So, and people, there's always this vaccination hesitancy, I guess, all over the world, right? And that happens too in Indonesia. So people were not vaccinated, people were not educated about the new variant, and people just started to take off their masks. People just, visit friends and family. We had many holidays in May, and people just moved in and out frequently, and therefore today.
I understand there's been a lot of disinformation that has been floating around in Indonesia. Have you seen any cases of people, I guess, self-medicating when it comes to coronavirus?
Yes, a lot. We are seeing that now, and we actually have been seeing this too in last year. So things like the confusion with, hydroxychloroquine can cure coronavirus. And now we saw, for example, ivermectin can prevent coronavirus. And so you have to take this and that doses. And because of this news, and there's no fixed confirmation from our government. And people are just so confused. And in Indonesia, I guess you can kind of buy all these things. So people try to self-medicate themselves, trying to prevent the virus with these medications. And what I'm afraid is that they throw away their mask and they are not getting the vaccines, but instead they will just buy these medications that we are not know nowadays. We do not for sure what they will do, right? But they just believe in these medications rather than the vaccines or the mask.
I understand you must be so busy at this time. You know, you've been working endlessly since the coronavirus really began. Thank you very much for your time today.
Thank you too. Thank you so much.